Good morning, everyone. Today we're going to have a look at the X-rays of the knee joint in a patient with osteoarthritis. These X-rays are typically taken in a standing posture, also known as weight-bearing views. This helps us in better evaluation of osteoarthritis. Let's start with the basics. There are a total of 4 characteristic findings we are looking for. Okay, now, can anyone point out the most apparent finding on these X-rays?
Yes, Dr. Hassan, the joint space seems to be reduced in these X-rays.
Absolutely correct. The joint space narrowing is a primary indicator of cartilage loss. More specifically, one should say that it is the medial joint space narrowing.
But why the medial joint space is reduced more than the lateral side?
That's a good question. One key reason for this is that the medial compartment of the knee often bears more weight and stress compared to the lateral compartment. Over time, this leads to accelerated wear and tear of the articular cartilage. As the cartilage gets damaged more, the space between the femur and tibia narrows, leading to the characteristic medial joint space narrowing. Now, apart from the reduced medial joint space, what other changes can you see in these X-rays?
I can see these bony projections. Are these the osteophytes?
Exactly, osteophytes, or bone spurs, form at the joint margins. They are the body's way of trying to stabilize the joint. As the cartilage wears away, the bones start to rub against each other. This friction stimulates the growth of osteophytes. While they are a sign of the body's attempt to repair the damaged joint, they can unfortunately contribute to the symptoms like pain and limitation of the range of motion in the affected joint. Now, can we see some other changes on these X-rays apart from medial joint space narrowing and osteophytes?
Well, I might be wrong, but there seems to be increased density of bone just below the cartilage, this whiter area under the surface.
Well done. This is known as subchondral sclerosis and is indeed seen as a whiter area beneath the cartilage.
But what causes the formation of these whiter areas?
Well, in osteoarthritis, as the cartilage erodes, the underlying subchondral bone is subjected to increased stress and mechanical load. As a response, the bone thickens and becomes denser, a process called sclerosis. This is visible on X-rays as areas of increased opacity or whiteness beneath the joint surface. Subchondral sclerosis can contribute to joint stiffness and pain. So far, we've learned about 3 features of osteoarthritis on X-rays of knees: medial joint space narrowing, osteophytes, and subchondral sclerosis. Now tell me if you can see the 4th and the last of the changes.
I can see a darker area near the joint surface. Could this be a subchondral cyst?
Good eye, well done. Subchondral cysts are less common but can appear as darker areas due to being fluid-filled sacs. Subchondral cysts form in the subchondral bone, as the name suggests. It is the layer of bone just beneath the cartilage in a joint. So as the bones rub against each other, very small fractures called microfractures can occur in the subchondral bone. Synovial fluid, which normally lubricates the joint, can seep into these microfractures, leading to the formation of cysts. On X-rays, these cysts appear as small, rounded areas of radiolucency or dark spots within the subchondral bone. These can contribute to joint pain and dysfunction when they are large or numerous. Now, just to see if you've understood the findings in osteoarthritis, can someone enumerate the 4 changes we're looking for?
Oh yes, Dr. Hassan. The 4 changes in osteoarthritis include, firstly, medial joint space narrowing, second is the osteophytes, third is the subchondral sclerosis, and the 4th one is the subchondral cysts.
Yes, that's just brilliant. I'm very happy with you all. By identifying these features, you can diagnose osteoarthritis and assess its severity. Best of luck in your exams, everyone, and happy learning!